unfortunately, it is quite a controlled substance. So unless patient has a diagnosed growth hormone deficiency, kind of difficult to make the case to prescribe this to patients. Now brings us to the peptides. These growth hormone releasing peptides like sermorelin here. Similar to the growth hormone, these are amino acid chains, and they help tell the pituitary to start making more growth hormone. So, we know growth hormone declines with age, and all these things that we associate with normal aging, right? Decreased bone density, decreased energy, decreased cognition. We potentially could treat this and reverse this instead of letting someone decline with age. So very cool, these GHRH peptides out there. We're going to go through a couple of them because there's quite a few out there. Sermorelin studies, usually it takes quite a while for sermorelin to take effect, as from what I'm seeing. Not one of the strongest peptides out there. One of the oldest ones, though, this thing was, it's another one of these growth hormone releasing peptides. Very interesting. A lot of these improve collagen synthesis. So you have someone maybe losing their hair, skin thinning. Very interesting. You see in studies, especially on elderly patients, their skin gets thicker. You know how the elderly people, you look at their skin and it's so frail. It looks like a wet paper that can break. And I can't tell you how many times I had to tape an old person's skin back together in the urgent care after a slip and fall. Absolutely terrible to see this collagen wasting as people age. These growth hormone releasing peptides show the promise of helping improve collagen. So hormone releasing peptide associated with decreased body fat, improved sleep quality, increased cognition, quicker recovery times post-injury, increased muscle mass, increased strength. So patients in obesity, they tend to have a lower growth hormone in the first place. So you can measure this. This is what I do pretty commonly in my practice. I measure an IGF-1 in my patients, and I see if they have a clinically diagnosable adult growth hormone deficiency. This is often, you see this in elderly, and you see this in the obese patient. And then using something like these can help, hopefully, kickstart back that growth hormone, and they can start retaining more muscle and hopefully balancing out that predominant fat tissue.